Hi, I'm Dr. Julia, and I'm back with the series that started as my attempt to increase engagement in mindfulness activities outside of work. Instead, it became me talking about work some more while coloring. And I want to continue talking about fun facts. So one of my favorite fun facts from psychology is just how strong the mind and body connection is. And especially strong is the gut-brain connection. So even in the simplest terms, think about when you are excited or nervous about something, all the different phrases we use to describe that feeling in our belly. So butterflies in our belly, or kind of knots in our belly, or it feels like a sucker punch when we feel like really sad about something. And that's because our brain and our GI system are connected via the vagus nerve, and so they are in pretty constant communication. And so it works both ways. So what you eat and what your diet is like can impact how you're feeling emotionally, but vice versa. If you're feeling anxious or stressed, you might not even necessarily think you're feeling anxious or stressed, but your body kind of is telling you that something is off. And so that is a very strong feeling. I would not ignore your gut instinct or your gut feelings, unless you have anxiety, in which case maybe do ignore your gut feeling and do gradual exposures to the hard stuff. Another common myth is that people can just grow out of mental health issues. And sure, for some that can happen. You know, if you're mostly anxious about a life transition or there's something happening in your life that's very specific to that time, yeah, you might not have symptoms in a year. However, when it comes to things like OCD or anxiety or kind of longer term depression, we know that ignoring it does not make it go away. And early therapy or early intervention is pretty much always recommended. There's very few cases in which case a therapist will see a patient and be like, nope, there is nothing I can help you with. And of course, we don't want to over pathologize, but you also don't need to have a severe mental illness to pursue services, right? You don't need to meet criteria for like severe depressive disorder. You are allowed to go get support, get therapy, get services just for regular old depression, or even just feeling down for an extended period of time.